So today, folks, I'm going to deliver some hard truths to anybody that's been subject to the medical system. And I'd like to think that I'm going to give you a balanced view as well. This isn't going to be all one way doom and gloom. What I want to do is give you a full picture of exactly what you're getting yourself into every time you go to a doctor. Every time, folks. I'm going to tell you some of the stuff that they do tell you, but the big thing is I'm going to tell you a load of stuff that they don't tell you. And this is the stuff that you're probably not looking up until it's too late. So the odds are the people that will be attracted to this video, the ones that already start to know this, or they've started to realize, they've started to wake up to what the medical system actually is, what it does, and how it helps and how it doesn't help in occasions, folks. So this is for anyone that would like a broader scale view of what the health service is, what doctors do, their role, and how you fit in amongst that. So the first thing, folks, let's start with something. I really want to wake you up. Let's give you a jolt here. So I started my nurse training back in 1992. I studied to be a nurse, and one of the first things they made us study was social policy. They wanted us to understand how government policy works. And the first thing I had to do, it seemed so boring and pointless at the time. They made me read a document called the Tomlinson Report, which you can find readily available. This was written in the late 80s, early 90s time. I got it, I came across it in 1992. So they got a guy called Tomlinson to go out and tell the government, what is the problem? What problem do we have to solve here? Now, here's the problem that the Tomlinson report had to address. The problem, folks, that the government had to look at. So when I read this in 1992, big report saying that by 2020, the problem that we have in the UK is that most of the population, the native population, will be 50 above 50 than below it, which means we're heading to a point where there's going to be lots of people claiming from the system and not many people paying into it. That's the problem the Tomlinson report had to solve, folks. So if that doesn't scare the hell out of you, especially if you're 50 plus, a bit like me, as to what the NHS really thinks about your longevity and your well-being, then nothing will. The bottom line is that if you're older and you're not working, you're not paying into the system, that you are the problem that the government has to solve. So ask yourself, how motivated do you think the government really is to look after our elderly and vulnerable citizens? And if that wasn't apparent during COVID, then nothing will be. But that's another video for another day. And that could take me off spiraling down what some would consider the conspiracy theory route. So I'm not going to go down there on this video, folks. This is going to be about facts. Facts, folks. I'm going to give you facts here. So I worked, for anyone that doesn't know me, anyone that's new to this video, to this channel, I trained as a nurse. I started my nurse training in 1992, and I worked in or around the health service until 2009. Now, I took some time out around there, but certainly while I was in the care service, I worked in 3 different continents, and I worked for over 13 years of my life. So that's what qualifies me to talk about this stuff. I'm not just a conspiracy theorist, folks. I'm not just a conspiracy theorist. I've seen it from both sides. I have seen this from both sides of the coin. So I'm going to give you what I consider as balanced a view as possible. So I'm not here, absolutely not here to say anything bad about doctors. In personal development, we have a premise when we start working with people that everyone is doing the best with the tools that they've been given. Now, doctors are considered agents for good, healers, shall we say, and yet they're only given very short time to sort out the problems of the masses. Most health and well-being problems are complicated, and it is a rabbit hole depending on how deep you want to go down it. There's certainly, in the world of energy, There's a philosophy, and it's not just a philosophy. This is well tried and tested. And I can tell you, I can give you case after case after case after case, if you want, of people that realize that everything medical that happens to them, there's a psychological reason for it. And stress is the trigger. You want to know the cause of long-term medical illness? Stress, folks. Stress. Stress is the enemy. I've spoken loads about this, though. So on my channel, in my videos, you'll have lots of reference of that. So I'm not going to dive deep down that rabbit hole today. What I am going to say is that the government has no incentive to keep you alive longer than you're able to contribute to the system. And doctors have been given a set of tools and parameters that do not always work in your favor. So let's take another step. I want to be as objective as I can. For acute illness, for pain relief, then the NHS has some phenomenal tools, and doctors can be a force for good. Because let's face it, if you're in pain, really bad pain every day, you want something that can take that away. Now, the fact that some people get addicted to painkillers, well, that's another conversation for another day. But that is part of what I'll be talking about today. So the pharmaceutical industry are pretty much the representation of the health service. A pill for every ill, folks. There's a pill for every ill. But what people don't talk about is the numerous side effects that happens, especially for long-term use. And it's very difficult for doctors to monitor every one of their patients, which is why it's really important that you take responsibility for your own body and your own mind. And if you're the person that blindly takes pills because the doctor gives them to you and just keeps taking them and taking them and taking them and hoping that nothing is going wrong, then you are the people I'm talking to. You're the people I need to wake up, folks. Wake up, wake up. So I'm going to tell you now, and this is the big overarching thing, that you are the most responsible person for your own body, and nobody knows your body like you. So I'm going to also do a little bit of a reveal now. When my granddad was alive, I used to monitor, I used to track his observations, his blood pressure. He'd been given all sorts of blood pressure pills over the years for times when when he had elevated stress in his life. But these were given long term. Now, these are things like your beta blockers, your ACE inhibitors, what they are. So these are your atenolol, these are your captopril or capogen or whatever the name they're called these days. But drugs like this to restore your blood pressure. Now, if you've got elevated stress in your life and you start taking these pills and they bring your stress down, and then suddenly somewhere down the line, you've got less stress in your life, then it can be dangerous if you're taking these because it will suppress your blood pressure to a point where you'll get up one day and you'll collapse. And this is what happened to him. And this happens to a lot of elderly patients, folks. On the days where you're not as stressed and you're taking these, let's just call them stress reduction remedy or blood pressure reducing medications, of which there's a load of them. There's a whole host of stuff that people take to reduce their blood pressure. But just because they work in the short term doesn't mean they're going to be working in the long term. And there's going to be days where you're going to get significantly less stress. You're going to be taking these drugs and they're going to be putting you at risk. So let's bring this alive. A ton of patients used to come to us because they'd fallen over at home. And especially elderly patients that live on their own. If you fall over and smack your head at home and nobody's checking up on you, a lot of people die at home because of this. It's time to wake up, folks. Time to smell the coffee here. Because I used to see case after case after case of stuff like this. People that were prescribed something for a short-term stressful situation that they kept taking and taking and taking. The stress left their life. They kept taking the drugs and then they collapse because no one's monitoring it. And they trusted their doctor that this is the reason that I'm not feeling the stress. No, the stress might be that you were living with someone stressful, you were dealing with someone stressful. They might be out of your life now. And you're still taking the stress reduction medication. We need to wake up. We need to take responsibility for all of the drugs that are given to us. And I'm going to tell you now, and this is me personally, and this definitely isn't medical advice. Nothing that I'm giving you today is medical advice. This is just an awareness, a report, a documentary, call it what you will. This is one guy's opinion based on a ton of observation of this area, of the massive controversy that I see caused, of the litigation that families give when they realize that all is not well and something went wrong. Well, this is just a wake up call, folks, to monitor stuff, to monitor stuff. So I haven't studied any of this stuff for since I've left the health service in 2009. But the current research papers that I was looking at right up until then told me stuff like simvastatin, the stuff that you take to reduce the fat in your blood. It was negligible whether they work or not. So many people I speak to, they go on these mad diets to reduce their blood cholesterol levels, and they realize it hasn't worked because stress is more, it's more of the cause. If you're taking these things and the stress is still in your life, then it's not going to make any difference. You're just going to end up eating loads of stuff that you don't like and feeling angry at the end of it if your blood cholesterol levels haven't reduced. They don't give you the full picture. You have to, only you have the full picture for your life, and to monitor your loved ones, to check their blood pressure regularly. Get that blood pressure monitor, check it, make sure that they're not dangerously low on their blood pressure. There's so many things. This is just one aspect of tons of stuff that we're given drugs for the short term, for long-term use, for short-term symptoms, but long-term use. Just because you're getting a lot of stress today or this week, or you've been having it this year, you might just have lost a loved one. That's a massively stressful thing. But over time, that stress would get less. It never goes, but it would get less. But if you're still taking the same medication that you took, over time, eventually, it could be dangerous. There could be a tipping point with your blood pressure. And these are things people don't talk about. And that's just the tip of the iceberg, folks. Every single pharmaceutical drug has a ton of side effects, like tons of them, tons and tons and tons. And if you don't know them, you would never know what to look out for. And so many people, especially the elderly that had no next of kin, would quite often lose their lives due to bad prescriptions. And here I am, I'm coming out and saying this stuff now. I'm out of the NHS. They can't sack me for it. But it's a fact, folks. These are the facts. Here's another fact. We used to see every year people, elderly and vulnerable, that had taken a flu vaccine. They'd come in with flu-like symptoms and they never left the hospital because their immunity wasn't able to cope with even a reduced amount of flu that they were given through the vaccines, folks, the vaccines. Facts, facts, folks. And I've seen this myself. I've seen people that have had that. The only thing that they could put it down, they had the flu vaccine within the last few days, and suddenly they've got the flu and they're in hospital and they never get better again. This happens, folks. This happens at the front line. People aren't allowed to speak about it because they lose their jobs. They lose their jobs. Well, guess what? I don't work for the NHS anymore, so I don't have to worry about losing my job in the NHS. I may have to worry in the current climate that this might go down as misinformation, but I challenge anybody, let's go head to head. I will go into a debate with anybody on this subject and let's see how they stand up. Let's see. Well, the fact is that it doesn't matter what they say. I've seen this stuff with my own eyes, seen it with my own eyes. Did I keep documentation of these cases? No, I absolutely didn't. That wasn't the way I was operating at the time. But there is a part of the reason that I left the NHS because I realized I went there to help people. And I realized that what I was eventually was a government sponsored drug dealer. That's what I told people. I sometimes tell people my previous career was a drug dealer. They're like looking at me, and that's what you are. That's what most nurses are. You're paid to legally hand out drugs. Now, there are drugs that are illegal with less and less dangerous side effects than some of the stuff that they give out legally. Facts, folks. Facts. These are facts. Even look at stuff like prednisolone. So you're talking steroids here. Now, that has a place in short-term acute medicine. Sometimes you need it's like a resuscitation of whatever they give it for your adrenal glands and stuff like that, jolt you out of there. But the side effects of long-term steroidal use are terrible, folks. Forget the moon face and the diabetes. I mean, there's other stuff as well, that just one thing leads to another and it's a downhill. When you're continually taking a drug to jack up one area of the body, the other areas of the body have to adjust. And without going into an in-depth pharmacological explanation of how your body works and the impact of individual drugs on your body, then I'm not going to have that conversation with you. I'm just going to say that you need to be aware. And doctors they don't have the time to explain all this to you folks. They get 15 minutes to sort your life out. Your GP does anyway. And the hospital doctors are so busy. They're so busy sorting out hundreds of patients, they don't get the chance to sit down. And nor do the nursing staff. I never had any time. I didn't have a lot of spare time during my nursing time because I'm constantly running around, constantly doing things. You can give people cursory overviews of the stuff that I'm talking about in this video, but there are massive, there's long-term reactions. And just look at some of the people. I'm sure that you probably, if you're my age, if you're 50 plus, then the odds are that you know somebody that has had a medical issue and they're struggling with their medications or the doctor doesn't know what's wrong with them. So that's the mad part. And I'm not here to blame doctors or the medical system. It is what it is, folks. Let's look at the other side of that coin. If you get sick most places in the world and you don't have any money, that's it, you're screwed. Like, look at America, for example. I would much rather take our care system. And not only that, there's been times I've had to have operations myself. I've had to have treatment in the NHS, and I've got nothing but good things to say about the treatment that I got. I'm not here to slag off our health system or not doctors and nurses. Quite the opposite. I understand the pressures that they're under. But the fact is, it is what it is, folks. The pharmaceutical industry control it. And the stuff that I got into, the alternatives, the energy medicine, and the mind-body medicine, the stuff that there is a psychological roots to all of your medical issues, they don't have time to educate you on that or even entertain it, folks. I became increasingly rogue. I was using energy work on people and getting some phenomenal results sometimes. And I wouldn't even tell people what I was doing because they couldn't understand it. These are the facts. In a couple of cases, this happened. A couple of cases, doctors would say, this person's dead or they're going to be dead in a few days. Tell the relatives, say goodbye. And I'd be doing energy work on them. And suddenly a miraculous second wind, and no one could explain it. Doctors with eggs on their face, having told relatives that there was nothing more they could do, they're suddenly having to arrange discharges. Now, this is not common, folks. So don't think, oh my God, who is this guy? And just so you know, as a healer, I don't heal anyone. I don't. I provide a space for them to either heal themselves or not. And any good healer will tell you that. People are either ready to get better or they're not. Some people just want to die and they want to die in peace and they're ready to die. And a lot of my role was preparing next of kin for that. But these are the facts. And now I'm going off on a tangent and I've addressed this in other videos on my channel. I've talked about all of this stuff, folks. So I'm going to give a little pre-plug that if these interest you, these areas are interesting to you, or you want to learn more about energy medicine or mind-body medicine, or how to empower yourself with your own health and well-being, then you definitely need to subscribe to this channel. Because I drip feed techniques, I drip feed ways, exercises that you can use with a practical use that will make you to feel better. That's the point. I'm not going to take away your pain. Your pain is here to drive you. Our pain is here to wake us up. When we're doing stuff in our life that we don't love, that we're not feeling connection with, eventually you will get pain. It will start in your mind, and then somehow it will manifest into your body. Toxic thoughts lead to a toxic body. That's ultimately where it's at, folks. Again, that's lots of different videos for different days, and I covered this content on my channel. But the point being that you have to be your own doctor. You have to take responsibility for your own body, because the government is just not motivated. It's not really their problem. And if you hand over the keys to your own health and well-being, then you could quite easily be inviting an early death. And there's no, I can't sugarcoat this, folks, because that's the reality of the situation. It's very disempowering to think that a doctor has all the answers to all of your problems. And it's unrealistic to expect that of them. They do what they can. And most of them operate for the very, very best. And they're good people. Not all of them, for certain, not all of them. Some are just in it for the paycheck, and some are actually quite psychopathic in the way that they come across. But anyway, another conversation for another day, folks. But anyway, I digress. The point being that it's your duty to take responsibility for your own body. It's your duty to know what's going on internally. And it's your duty to speak with doctors and tell them, no, I'm not taking these. If you are feeling lightheaded and you're on antihypertensives, then check your blood pressure, at least have the facility to check it. And if it's not shooting up, if it's at reasonable levels, certainly if it's below 130 over 100 over 80, what am I talking about? I've been out of it for too long, but a sort of normal age, your blood pressure generally goes up as you get older. So up until you hit about 45, 120 over 80 is a very normal blood pressure. You would expect the first reading to go up as you get older. So in your 50s, 60s, certainly having 140 as your top thing would be completely normal. No, and if it is completely normal, but it really is, everybody's different, folks. You have to monitor it yourself. You have to be responsibility. You have to be responsible for your own body. Everyone's different, and you need to know where the baseline is. Now, if your blood pressure is normally 140 over 80, and then one day you wake up and it's 110 over 80, and you take your antihypertensives, then you're almost definitely inviting a collapse. Simple things like that, folks. In the same way that you wouldn't just take your diabetes medication without checking what your blood sugar is. Same with your blood pressure, folks. Your pulse, your blood pressure. These are things that anyone can keep on top of with themselves. And with this age of health technology now, I mean, there's certainly monitors or watches you can wear that gives you a complete picture of what's going on in your body. So there's no real reason now to not at least be a little bit interested in what's going on in your body and to take a lot more responsibility for what's happening to it. So this, I hope, is just a wake-up call for you. If you're looking after loved ones, to be on top of it, to take these readings. It's your job to inform doctors and to say sometimes, no, I disagree with you. Don't be afraid to disagree and push back with doctors. They're not always right, folks. And I've had situations where doctors wouldn't even talk to me because as soon as they get a sniff that you know what you're talking about and you start pushing back, it threatens them, especially when they've got no good reason to come back at you. And I've had these conversations time and time and time again, folks. So I don't wish to be sensationalist. I'm not here to slag off the health service. I'm just here to say, again, that they're doing the best they can with the tools that they have, but they are not always right. And ultimately, especially if you're not working or paying into the system right now, you have to ask yourself, how much do the government really care about your life? You're just a statistic. You're just a drain on the economy as they go out spending money on obscene things for themselves and taking hospitality bribes and funding wars overseas, folks. That's where the priority is. Let's make sure we get in there and mess someone other's country up. But I don't wish to get political right now, folks. That's another video for another day that I'll probably never post because I'll probably get delisted on every channel that I go on. But the bottom line is, it's your body, it's your mind, and you are your own best practitioner when it comes to that, folks. So never, ever, ever trust anyone. And even if it's a case of just getting a second opinion, sometimes trust your intuition, trust your instinct, and trust how you feel. They're the foundation of what I'm talking about today. And if you really want to up your game, folks, if you really want to start taking a more responsible, empowered approach for your own mind, your own medicine, your own way that you think about these things and that you function, then you definitely need to be subscribed to this channel, especially if you're still watching now, folks, especially if you're still watching, because statistically, most people won't be. So there you go, folks. Please subscribe in that little box there. It will help you. It will help me. It will help get this message out. It may even help me get delisted the way I'm going at the moment. But again, that's another conversation. Just get over to Rumble, folks, if that ever happens. Register on Rumble. You'll be able to find me there and they're less likely to delist me. If you want more content on there, then just click that video there. And thank you for your time. Look after yourself, my friend, because the doctors may not always do so.